So we spent a lot of time over the last 7-8 years now working with patients and focusing on patient experience. And because we were focused on the patient experience, we were not thinking as much about family caregivers, and we realized that we needed to sort of move in that direction if the overall experience was going to be good for the patient, for the family caregiver, and for the healthcare team.
We know the power of storytelling in driving change and inspiring difference. For us at the Change Foundation, it's incredibly important for us to do all of our work based on actual experiences, and we like to co-design our products and our knowledge and shape everything we do based on actual caregiver experience.
We were approached by Carol Ann about 3 years ago now with a colleague of hers, Sarah Shirkani, and the two of them had been working together to try to give voice to the family caregiver experience. I said, so what would actually make a difference? And she said, you know what, we have this idea of a caregiver wish list, and she literally gave me 3 pages of text that the two of them had put together, and it was just this practical set of ideas.
So I started on this project about 9 months ago, and when it was just a gleam in Carol Ann's eye, and have been working on it pretty consistently ever since.
This is a really unique project that we've never done before, so we'll all be learning together. We're not really sure what the actual specific outcomes will be because it's going to be a very dynamic conversation, and that's what makes it so interesting.
So we're bringing in these other caregivers to go over the wish list and add to it or change it or comment on it and talk about their own experiences to make it a much richer experience for caregivers. I'm really excited about the fact that there's video here because we'll be able to get people in their moment talking about their own experience, and there is nothing to compare like lived experience.
What we've tried to do as much as possible is to embed the caregiver voice in a real way into the creation of this video, not just one caregiver's voice and not just at one point along the way.
Working with the Change Foundation has been a wonderful experience. It's true co-design. They value my lived experience. They want to learn from it. They ask questions about it. And this is my dream come true.
Originally, when we thought about this idea of a wish list, I kind of had this perception or thought or idea that we would need a separate wish list for young carers because I thought their needs would be so distinctly different. And in the end, I'm not sure we do need a separate one for them, and actually a separate wish list that sort of speaks to the unique experiences of those supporting family members with mental health and addictions might be required instead of a separate one for young carers.
It was very rewarding because I have been working with this for a long time, and there was one particular caregiver who, when I talked about my story and how I wished it had been different and what I wished had happened, one of the other caregivers said ditto. And I think that just really sums it up. I mean, every caregiver's experience is different, but the themes are the same.
For caregivers, I hope that they leave feeling like they're not alone. They have some tools and tips to actually help them advocate for their loved one or for the person they're caring for, and for themselves, and to give themselves a voice in a way that they maybe didn't feel they had permission for.
My hope is that the healthcare professionals who watch this will shift their thinking and think more about the patients and the family caregivers as the answer to some of the problems that they experience in the healthcare community.